Dog that has swallowed a foreign object. Foreign bodies or objects in the stomach or intestines is the veterinary term for when a dog has swallowed an inappropriate object. This is a common situation in young dogs who willingly chew and play with strings, balls, socks, etc. Cause. It can be difficult to prevent dogs from swallowing anything. Young dogs can be very curious about tasting and even eating things they find. This behavior tends to disappear as the dog gets older. If the swallowed object gets stuck in the intestines or stomach, the procedure to follow will depend on the size and type of object. If it is too large to pass the pylorus, it can remain in the stomach for a very long time, up to several months. The foreign body may cause sporadic vomiting and the general condition of the dog may be affected. If the object crosses the pylorus, passes into the intestine but remains stuck there, it blocks the transit and can affect the blood supply to the intestine, which further aggravates the dog's condition. If the object transits, it can perforate the intestinal wall. In this case, the object can end up with the contents of the intestine in the abdominal cavity, which can cause peritonitis. If this is the case, the general condition of the dog worsens rapidly and his life may be in danger. The list of items your dog can swallow is long and includes socks, underwear, toys, pine cones, pebbles, nuts, earplugs, tampons, corn cobs, bones, pacifiers, hair ties. Symptoms of a dog who swallowed a foreign body. If a dog has a foreign object in its stomach or intestine, the symptoms vary greatly depending on its location. Vomiting is common, often after the dog has eaten or drunk. The dog may also vomit sporadically over a long period of time if the object gets stuck in the stomach. The dog usually stops eating and drinking due to intestinal obstruction, but often continues to vomit. Some dogs with foreign bodies in the gastrointestinal tract may not vomit. The presence of foreign bodies in the stomach or intestine can cause a gradual or very rapid deterioration in general condition. An acute deterioration in the state of health can be due to dehydration, but also to damage or pain in the intestinal mucosa caused by the pressure of the object. Vomiting can also be symptoms of other diseases such as gastroenteritis, inflammation of the stomach and intestines, a food allergy or intolerance, or diseases of other organ systems such as the liver, kidneys or the pancreas. What can you do yourself if your dog has swallowed a foreign object? If a dog has swallowed a blunt object, it may be helpful to give him fresh asparagus. The asparagus threads wrap around the object so that it can drain naturally without damaging the intestine. In case of ingestion of toxic substances, contact the veterinarian immediately. There are medical ways to make a dog vomit, but are reserved for veterinarians. The owner cannot and must not do anything in this direction. When to consult a veterinarian? If the owner observes that their dog has swallowed a foreign object, they should immediately consult a veterinarian to attempt to induce vomiting using medication. This should be done as soon as possible after ingestion. If the dog is in poor general condition or vomits frequently, a veterinarian should also be consulted. Diagnostic. The veterinarian performs a careful clinical examination that includes palpation, that is, feeling the belly. If an inappropriate object is suspected in the stomach or intestine, the examination is generally completed by X-rays or ultrasounds. However, not all foreign bodies are visible on X-rays or ultrasounds, far from it. The examination is sometimes supplemented by a radiographic examination with contrast products. To perform a contrast radiograph, the dog is given a radiopaque liquid to drink which attaches to or is absorbed by the foreign object. X-rays are taken every hour or two to help locate the object. It can be difficult to diagnose foreign objects in the stomach or intestine. Sometimes the symptoms determine the treatment. Treatment at the veterinarian. If the foreign body has been swallowed within the last few hours, the veterinarian can sometimes flush it out by administering a product that induces vomiting. The dog owner should never attempt to make his dog vomit himself. If the dog's general condition is affected and he has vomited several times, he will usually be given rehydration solution intravenously to compensate for the dehydration. Since a foreign body in the stomach or intestine is often painful, treatment usually includes painkillers. If a foreign body has been detected in the stomach and attempts to vomit do not work or seem inappropriate, the object can be removed using an endoscope. This means that the stomach is examined using a long, flexible instrument with a camera at the end. The object can often be removed from the stomach by various means. If a veterinarian suspects a foreign object is stuck in the intestine, surgery often proves preferable.